All right, so we'll do a file scenario. This is actually a scenario I've done in real life. I'm going to tweak it a little bit, but this is something that you can encounter. All right?
All right.
So you're going to get dispatched to a motor vehicle accident. When you get there, the firemen that were on scene are going to tell you that there initially was the car caught on fire after the crash.
Okay.
They do not know if the patient has been burned or not. They were able to extricate the patient. It did take about 20 minutes. They have them on the backboard for you already and on the stretcher ready to go.
Okay. All right. All right. So, BSI gloves. Scene, is it safe?
Seems
like it's secured. Okay. No additional resources because they're all there already. Mm-hmm. Do I see any other patients besides this one?
No, just the one.
Mechanism of injury. When I look at the scene and I look at the car, is there a bunch of intrusion into the car, anything like that? What do I see?
So there's massive amounts of intrusion. It was a sedan that struck the back end of a semi-truck trailer.
Okay, so that's a significant mechanism of injury. I'm really concerned I have a high index of suspicion for multi-system trauma there. And then with the fire, I'm concerned for burns, maybe some airway involvement too. So I'm going to have those in mind when I approach the patient. Okay. So general impression, when I approach the patient, are they alert and looking around?
They're not alert. They're not looking around.
All right. Do I get a sense for general age?
It is a male that is in his late 50s, early 60s.
Okay. When I look at him, what am I seeing? Do I see any immediate life threats? Do I get a sense for what his chief complaint might be?
No, you do not see anything that's immediate. What you do know is that he has a prosthetic left leg.
Okay. Unresponsive to pain?
He responds to pain.
Responsive pain. Okay. What does he do? Does he posture at all, or he just
He just kind of lifts his chest up a little bit and groans a bit.
Okay. Definitely gonna maintain that C-spine for him because he's only responsive to pain.
Okay, how are we gonna do that?
Gonna have my partner hold his head steady, 2 hands side of his head.
Okay.
And we're gonna keep that until we're able to put a C-collar on him.
Okay.
And does he look? I mean, he looks sick because he's
I wouldn't say he's sick. He's definitely injured.
Injured, yeah. High index of suspicion for multi-system trauma here. Major bleeding?
You do not see any major bleeding.
How's his airway? Any stridor, gurgling?
You see you hear a good amount of gurgling. You hear, you look and you see there's a good amount of saliva mixed with blood.
Okay, so we're gonna open up that airway.
How are you gonna do that?
I'm gonna do the pincher technique, and then also do a jaw thrust. Because I'm worried about C-spine injury.
Okay.
And then suction.
Okay, the suction clears the airway. You're getting minimal respirations.
Okay. So we're gonna put him on a BVM. Every 6 seconds, 5 to 6 seconds, and 15 liters per minute of oxygen on that.
Okay.
I'm gonna have my partner. I mean, how many rescuers? Do we have a third rescuer? Because I want someone to...
Yeah,
okay.
grab one
all
of the firemen.
All right, cool. So they're going to be bagging him. SpO2?
SpO2 is, let's say, without the bagging, it was in the low 80s. Now with the bagging, it's slowly rising, heading towards the 90s.
Okay. How are their lung sounds?
Lung sounds are clear on the right, diminished on the left.
Regular, irregular respirations. I mean, we're bagging him, so we're kind of controlling that. Any accessory muscle use?
No, not really. It's not really put much of an effort.
All right. Circulation, no major bleeds, right?
Nope.
That we can see. Okay. Skin color, temperature, and condition.
Pale, cold, and diaphoretic.
All right. Pulse strength, rate, regularity, and equality.
It's going to be weak, rapid, regular, and equal.
Okay. Cap refill?
Less than 2, well, so it's at 2 seconds exactly.
2 seconds, all right. Shock, for sure. We're going to expose him fully because of the significant trauma and then try to keep him warm. We're going to cover him with blankets while we do that.
Okay.
Head to toe. So concern for hypothermia with the shock. He's receiving oxygen treatment. So um, we're going to do a full head to toe and then transport him. He's really unstable. So head decap ETLS bleeding, anything there.
When you take a look at the right eye, you're going to see that he's just got a massive laceration, pretty much starting right at the eyebrow, going towards the top of his right forehead.
Okay. Do I see any like brain matter? Does it look like an open injury?
No.
Okay, so, and is it bleeding pretty heavily? Or?
It's not really bleeding.
Okay.
Minimal bleeding.
Like, hold off on that. How are his pupils?
Pupils are non-reactive.
We cleared the airway, so, but is any more blood, vomit, anything like that? We'll check again. Okay. Any CSF in the ears, nose?
No.
Okay. And then I'll palpate the scalp and face. Any crepitus, instability?
No.
Does he flinch at all anywhere?
Nope.
Okay. So we might, yeah. I'm going to go to the neck. JVD,
No.
decap ETLS bleeding there.
What's decap ETLS stand for?
Deformities, contusions, abrasions, penetrations, burns, tenderness, laceration, swelling.
Nothing noted in the neck.
Okay. Tracheal deviation?
No.
And then any subcutaneous emphysema?
No.
Palpate down that C-spine.
You don't note anything.
Okay, we're going to put a C-collar on him. So do you want me to talk about how we measure it, or?
No.
All right.
You've done a few of these. I think you're
Okay, cool. And then his chest is exposed, so decap ETLS bleeding on that chest.
You don't see anything.
Okay. No, all right. Any subcutaneous emphysema?
No.
Flail chest?
No.
Adequate tidal volume with the... I guess, no, we're bagging him, so, yeah. How are his lungs now?
Still clear on the right dimension on the left.
Okay. So palpate shoulders, clavicles, sternum, ribs.
So you're going to feel major crepitus in the sternum and the left ribs.
Okay. But no flail chest on the left side. All right. Decap ETLS in that abdomen, bleeding.
You don't know anything.
Eviscerations,
No.
palpating, nothing.
Nothing.
Okay. So I can move on to the pelvis. Is that okay?
It's
I'm
your
gonna
call,
palpate.
man.
I don't know. They want us to run through that. So palpate all four quadrants. Any rigidity,
noted.
tenderness, nothing. Okay. And then pelvis, decap ETLS, bleeding.
Nothing noted.
Any priapism?
No.
I'm gonna palpate that pelvis, instability. I'm gonna push in and push down.
Pelvis is stable.
Okay. And then moving on to, you said he has a prosthetic on left leg. Okay. So how high up does it go? Is it like full?
Goes to his right knee, left knee, sorry.
Okay. His left knee?
Yeah.
I might take that off if I can, just so that I can fully expose everything.
Okay.
Decap ETLS on that upper extremity.
You don't note anything.
How about on the right?
You're going to note blistering red skin all the way down the right side of the leg, of the right leg.
The right side. So like full half of the leg. Okay. So that's like 9% BSA. Right, yeah. How big are the blisters?
They're pretty big.
Okay. So, that's a partial thickness, like a deep partial thickness burn is what I'm hearing. PMS?
You can't get anything because you're not going to be able to get more sensation. He's not alert, but you do have good pulses.
Pulse? Okay. And then when I palpate, any crepitus, instability?
Nothing noted.
Okay. I'll do the same with the upper extremities. So I'll pulse any decap ETLS bleeding, instability, crepitus.
So pulse is good, no motor sensation. You don't note anything else for the upper extremities.
Okay, and then we're gonna log roll him to take a look at the posterior, decap ETLS bleeding. I forgot sucking chest wound in the chest, but sucking chest wound in the back.
Nothing noted.
All
no
right.
second chest wound on the chest either.
All right, palpate.
Nothing felt, except
Okay.
you feel crepitus along the back of the left ribs.
Back of the left ribs. Okay. Yeah, so full immobilization on this guy.
What does that entail?
I don't know. I'm a little hesitant. No, I do. I'm a little hesitant on the backboard with the issues breathing. But okay, so he's on the backboard. We're gonna keep his head. He's got this C-collar on. We're gonna put padding on each side of his head and then tape.
Okay.
So he's like, he cannot move at all. And then we're gonna strap him in. We're starting with the chest and then moving down the body.
Okay.
Yeah, and we're transporting him. Anyone on the scene that could tell us anything about this guy? Do we know?
No, the only bystander says that he fully crashed into the back of the semi-trailer. It does not appear that he put the brakes on whatsoever.
Oh, okay. All right. So we don't have any medical history on him. Anything in the... Okay. So I'll go vitals then. How's his BP?
BP is going to be 72/38.
Yeah. Heart rate?
Heart rate is 120.
I guess we're controlling his ventilations. Pupils?
Pupils are still not reactive.
SpO2?
SpO2, let's say, is 94.
How's his blood glucose?
Blood glucose is 32.
All right. We can use triglucagon, but definitive care is getting him to the hospital. But,
okay, you go to attempt to put the glucagon or administer glucagon through IM. However, you notice that, you're not really feeling anything in terms of he's not really responding to pain anymore. He's just kind of going limp on the backboard.
Okay, I'm going to check his pulse.
He has no pulse.
All right, CPR. We're going to pull out that AED, put that AED on him.
Okay.
Does it suggest a shock?
Does not suggest a shock.
All right, we're going to do another full round of CPR.
Okay.
I'm gonna place an iGel while we're doing compressions. So it's 30 to 2 until we get that iGel in, and then we can do continuous compressions.
What do we need to know for the iGel?
Once it's placed, we're looking or listening to see
Before even that.
How much does he weigh?
Patient weighs 200 pounds.
Okay, so I think that's size 5, like the biggest size.
Yes.
Yeah. So we have to loop that up. We're gonna do the tongue, jaw, place it till we don't feel any more resistance, and then put the colorimeter on, attach that BVM, or just the bag, and we're listening for any epigastric sounds.
Not present.
Okay. Lung sounds clear on both sides, or present on both sides.
They're only going to be present on the right side, it's still diminished on the left.
All right. Adequate chest rise and fall on the right side.
You see it good on the right, yeah.
Okay.
Little not as good on the left.
Yeah, makes sense. Condensation, color change. All right.
Volumetric turns gold.
How's his skin conditions?
He's getting a little bit of color back, but not too much.
Yeah. An SpO2, we'll check that too to make sure that...
Say SpO2 is at like 92.
Okay, so we can go ahead and tape it and secure it.
Okay.
We're still transporting. He's really unstable. My field impression, he's got... I guess I should have covered the burns. So we're going to do that. We're covering the burns. We're covering any visible injuries. I'm going to use dry sterile dressing.
Let's say you only got 3 people, so you got one person driving, you have
all right.
one person
okay.
controlling
So we're not
the airway,
doing any of that.
one person compressing.
He's got a blanket over him that'll keep stuff off of him. Okay. Yeah, and then we're reassessing every 5 minutes as we take him to the hospital. Vitals, repeating the primary. Does the AD advise a shock at any point?
At no point does it advise a shock.
Yeah, okay. Well, we'll keep doing compressions.
All right, let's hear the radio report, and then I'll have one more question for you.
Okay. So, hey, Northwestern. Okay. We're taking him to a level 1 trauma center. How do you copy?
Good copy.
All right. We have a 60-year-old male with found responsive to pain in the field after a significant MVC with significant intrusion into the vehicle and a vehicle fire. He eventually became unresponsive and pulseless So we initiated chest compressions. We got him on an eye gel, and we're ventilating right now.
Is this a cardiac arrest you're bringing in?
Yeah.
Okay.
With significant trauma. Diminished lung sounds on the left with significant crepitus, both on the posterior and anterior of the chest on that left side. And he also, bystanders stated that he crashed into the back of a semi and didn't look like he was doing anything to brake. Took a blood glucose. It was at 38. We administered glucagon, but he went pulseless at that time. So we're focusing on that CPR. Do you have any further questions or orders?
Yeah, do you have them backboarded and collared?
Yes, sorry. Full immobilization in the field.
Okay, what's your ETA?
5 minutes.
Okay, and we're doing compressions. We got an AED.
Yeah,
Okay.
AED does not advise shock. We've been doing continuous compressions.
All right, we'll see you in 5 minutes.
Okay.
All right, what do you ultimately think caused this crash and ultimately this arrest? What do you think happened?
I think he is diabetic, and he was hypoglycemic, and passed out or was severely altered, disoriented, didn't brake, crashed into that vehicle. I'm not sure if the diabetes or the hypoglycemia caused the arrest or all of his internal trauma. Probably a combo of both.
Yeah, that's so this was. Well, we'll talk about it, I guess, because I don't know exactly what I can say in terms of that. But this was a type of call that I ran with another instructor named Miguel at our fire department. It very much is one of those instances where it's a medical and it's a trauma combined, but you're not thinking about the medical aspect of it because, hey, this guy was just in a big car crash and then he went into a cardiac arrest. I'm not really thinking a lot of times people aren't even gonna think about checking a sugar during a trauma. So the fact that you did is very good. The only things you gotta tweak is that this is definitely in terms of contacting ALS or having this getting at least a paramedic on that ambulance with you because you need some more interventions for that. Again, I mean, this is your final scenario, so we're kind of throwing everything at you. Don't worry about that. But in reality, in terms of this guy getting the best care, let's try to get some more interventions. But that's not the purpose of what we're trying to teach you as EMTBs.
Gotcha.
2 is just your radio report. The first word's got to be hey, this is cardiac arrest, because you don't want that nurse motherfucking you at the end. We're just coming in with this 50-year-old, just car crash. Oh, it's a cardiac arrest. And they're just going oh God. So
sorry.
But you did very well in terms of you got through the head to toe. You got through the vitals. You recognized that it was hypoglycemia and ultimately what caused the car crash and ultimately the cardiac arrest. So it was good.
Thanks. Thanks for doing that.
No worries.
Oh man.
No. All right.